It is the first week of January. You wake up, make your coffee, and open your bank account on your phone like you do every month. Your Social Security check came in. But something feels wrong. You do the math in your head. Last year you were told you would get a raise, a cost of living increase, more money every month to help with your groceries, your utilities, your prescriptions. But the number on your screen barely looks different from last month. In fact, after you subtract your Medicare premium, you are actually taking home less than you did 6 months ago. You did not make any mistakes. You did not miss any deadlines. You followed the rules. And yet somehow, the raise you were counting on has almost completely disappeared before it ever reached your wallet. If that sounds familiar, or if you are worried it could happen to you heading into 2027, please stay with me. Because what I am about to share with you is something that millions of seniors across America do not know. And not knowing it is costing them hundreds, sometimes thousands, of dollars every single year. My name is Masha. I am a senior policy analyst and retirement finance expert. And on this channel, TaxWise Seniors, my entire focus is helping retirees like you understand the complicated rules that affect your monthly income, your Medicare, and your long-term financial security. In the next few minutes, I am going to walk you through exactly what is happening with Social Security heading into 2027. I will explain the COLA update, the Medicare premium situation, and the trust fund warning that every senior in America needs to hear right now. And please, do not leave before the end of this video, because I am going to show you a mistake that roughly half of all Medicare recipients make every single year. A mistake that silently costs them more money than they realize. And I am going to give you the exact steps to make sure it does not happen to you. Let me tell you about Dorothy. Dorothy is 71 years old. She lives in Phoenix, Arizona. She retired at 66, worked her whole life as a school administrator, and has been collecting her Social Security check every month without any problems. When she heard that Social Security benefits were going up again for 2026, a 2.8% cost of living increase, she was relieved. She had been watching her grocery bill climb. Her electric bill had gone up. Her prescription costs were higher than ever. She did the math. Her monthly benefit was around $2,000. A 2.8% raise would be roughly $56 more per month. Not a fortune, but it would help. Then January came. Her check arrived. She looked at the amount, and she felt a knot in her stomach. The increase she expected was almost completely gone. After Medicare deducted the higher Part B premium from her check, an increase of $17.90 per month from the year before, her actual take-home increase was less than $40. She thought that was bad enough. Then, a few weeks later, a letter arrived from Social Security. It said she owed an IRMAA surcharge, an income-related Medicare adjustment. Because her income in 2024, the last full year she had worked before retiring, had been higher than the Medicare threshold, she was now being charged an extra $95 per month on top of her standard Part B premium. Dorothy had retired in early 2025. Her income had dropped significantly, but Medicare was using her 2024 income, from a full year of employment she no longer had, to charge her for 2026. She had no idea this was happening. She had no idea she could appeal it. She paid the surcharge every month for almost a year before her daughter found out and helped her file the right form. Dorothy lost nearly $1,000 in unnecessary Medicare surcharges because she did not know about one form that Social Security has available for free. I do not want that to happen to you. So let us go through exactly what is happening and exactly what you need to do. The 2027 COLA. What we know right now. Every year, Social Security adjusts benefits based on inflation. This is called the Cost of Living Adjustment, or COLA. It is calculated by comparing inflation data from July, August, and September of the current year against the same 3 months from the year before. The official 2027 COLA will be announced in October 2026. As of right now, May 2026, the official 2027 COLA has not been released. But projections are already coming in from serious nonpartisan research organizations. The Senior Citizens League, a respected nonpartisan senior advocacy group, is currently projecting that the 2027 COLA will be approximately 2.8%. That is the same as the 2026 increase, which that same organization previously called meager. Other independent analysts are projecting the 2027 COLA could land anywhere between 2.8% and 4%, depending on how energy prices and inflation develop through the summer. Some of that range is being driven by rising oil prices, which feed directly into everything from transportation costs to grocery prices. Here is the critical thing I need you to understand. A higher COLA number is not necessarily good news. If the 2027 COLA comes in at 4% instead of 2.8%, it means inflation is higher. It means you are paying more at the gas pump, more at the grocery store, more at the pharmacy. The COLA is designed to help your benefits keep up with inflation. It is not designed to help you get ahead of it. And here is what always happens, every single year, that most seniors do not fully account for. Whatever the COLA increase is, Medicare comes and takes a portion of it before it ever reaches your bank account. The Medicare problem. Why your raise shrinks before you see it. Let us talk about what is confirmed right now. For 2026, the standard Medicare Part B premium is $202.90 per month. That is up $7.90 from the $185 it was in 2025. That increase alone consumed roughly 1/3 of the entire $50 monthly COLA raise that the average retiree received. For 2027, the official Medicare Part B premium has not been released yet. That announcement will come from the Centers for Medicare and Medicaid Services in November 2026. But I want you to understand why experts are concerned it could rise again. There are three forces pushing Medicare costs higher going into 2027. First, oil prices have surged, and energy costs affect healthcare delivery in ways most people do not think about: transportation, facility operations, medical supply chains. Second, tariff-related cost increases on medical supplies, and pharmaceuticals are working their way through the system. Third, a congressional report found that overpayments to Medicare Advantage plans have added tens of billions of dollars in excess costs over the past decade, a structural problem that has not been resolved. CMS sets the Part B premium based on projected Medicare spending, not based on inflation. That means even in a year where general inflation is moderate, your Medicare premium can still go up significantly. So when you hear the 2027 COLA announcement this October, do not celebrate until you also find out what is happening to your Medicare premium that November. Only then will you know what your check will actually look like in January 2027. The IRMAA trap, the mistake half of seniors never catch. Now I want to talk about the thing that cost Dorothy nearly $1,000, and that affects far more retirees than most people realize. It is called IRMAA, Income-Related Monthly Adjustment Amount. IRMAA is a Medicare surcharge charged to beneficiaries whose income is above certain levels. Here is how it works. Medicare looks at your tax return from 2 years ago to decide how much you pay for Part B and Part D. So in 2026, Medicare is using your 2024 income to set your premium. Not your income right now, your income from 2 years ago. If your 2024 income was above $109,000 as a single filer, or above $218,000 for a married couple, you are paying an IRMAA surcharge on top of your standard Medicare premium. Those surcharges are not small. In 2026, the lowest IRMAA tier adds over $1,148 per person per year. The highest tier adds nearly $6,136 per person per year. For a couple at the highest bracket, that is nearly $14,000 per year in additional Medicare premiums. Now here is where so many retirees get caught. If you retired in 2025, or had a major drop in income due to a divorce, the death of a spouse, or reduced work hours, Medicare is still using your 2024 income to charge you more. Income you no longer have, from a year you no longer live in. And IRMAA operates like a cliff. If your income goes even $1 above a threshold, you jump to the next bracket. The entire additional cost kicks in, not gradually, but all at once. Most seniors do not know they can appeal this, but there is a form, a free form, available directly from Social Security. It is called Form SSA-44. The full name is Medicare Income-Related Monthly Adjustment Amount, Life-Changing Event. This form allows you to tell Social Security that your income has dropped because of a qualifying life event, such as retirement, a reduction in work hours, the death of a spouse, a divorce, or the loss of a pension. When you file it with proper documentation, Social Security can use your current lower income instead of the old, higher income to recalculate your Medicare premium. You can file this form online through SSA's official portal. You can fax it, you can mail it to your local Social Security office, or you can call Social Security directly at 1-800-772-1213 and ask a representative to help you. If your appeal is approved and you had already been paying the higher surcharge, Social Security will refund the excess amount you were charged. And if Social Security denies your SSA-44 request, you are not out of options. You have the right to escalate through 4 levels of appeal, all the way up to federal court if necessary. Each level must be requested within 60 days of the prior decision. Approximately half of all IRMAA appeals that are delayed or denied are rejected simply due to documentation errors. So when you file, be specific. Include the date of your life-changing event. Include evidence: an employer letter, your final pay stub, a death certificate, a divorce decree, whatever applies to your situation. The more clearly you document the income reduction, the stronger your case. The trust fund warning. Every senior must hear. I want to say something now that I know some of you may not want to hear, but I would be doing you a disservice if I did not tell you. The Social Security Trust Fund has an official insolvency date. According to the 2025 Social Security Trustees Report, the official government document published by SSA every year, the Old Age and Survivors Insurance Trust Fund is projected to be depleted in 2033 under the trustees' best estimates. After that, the only money available to pay Social Security benefits would be incoming payroll taxes. And according to the trustees, that would cover only 77% of scheduled benefits. That means an automatic, across-the-board benefit cut of 23%. Since that report was released, the situation has worsened. SSA's own chief actuary confirmed that the One Big Beautiful Bill Act, signed into law on July 4, 2025, accelerated the depletion date from early 2033 to late 2032. The Congressional Budget Office's February 2026 baseline now estimates the benefit cut at insolvency could be as high as 28%. For a typical couple retiring just after insolvency, that could mean an $18,400 annual reduction in their Social Security income. I am not telling you this to frighten you. I am telling you because it matters for how you plan. Congress can still act. They have the tools to fix this. Social Security was nearly insolvent in the early 1980s, and Congress acted in time. But the earlier you understand the situation, the better positioned you are to plan around it, whether that means reviewing your other income sources, adjusting your withdrawal strategy, or simply staying informed so you are not blindsided if changes come. 3 steps to protect your check right now. Step 1. Log into your free My Social Security account at ssa.gov and check your benefit statement for January 2027 as soon as it becomes available. Verify your net payment after Medicare deductions and compare it carefully to what you received in January 2026. If the numbers do not make sense, call Social Security at 1-800-772-1213 and ask for a written explanation. Step 2. Check whether you are being charged an IRMAA surcharge on your Medicare premium. Look at your Medicare premium notice. You can find it in your My Social Security Message Center or in the paper notice you received in the mail. If you see an amount higher than the standard $202.90 per month for Part B, and if your income has dropped since 2024 due to retirement, reduced hours, the death of a spouse, or any other qualifying event, file Form SSA-44 immediately. Do not wait. Every month you wait is money you are paying unnecessarily. Step 3. Review your full retirement income picture before the official 2027 COLA and Medicare premium announcements come out in October and November of 2026. Do not assume that whatever percentage the COLA is, will translate directly into a larger check. Factor in the Medicare premium. Factor in any IRMAA surcharge you are paying. Look at what you will actually take home, not just the headline number. If you have a financial advisor, this is the time to sit down with them and plan around what is realistically coming into your account each month. Now, before I let you go, I need to say something important. If you rely only on YouTube notifications to stay informed about Social Security, Medicare, and benefit changes, you are taking a real risk. The algorithm decides what you see. A critical update can happen any week, and you might not see a video about it for a month. By then, a deadline could have passed, a form could have gone unfiled, money you were entitled to could be gone. That is why I want you to join our community right now. Click the link in the description below to join the TaxWise Seniors official WhatsApp channel through Global Senior Alerts. When you join, you will receive real-time alerts the moment there are important changes to Social Security payments, Medicare premiums, IRMAA rules, IRS tax updates for retirees, pension regulations, and benefit deadlines. You will also be able to download our free Senior Benefits Protection Guide, a plain English document that walks you through your rights, the most important forms, what to do if Medicare is overcharging you, and how to protect your check no matter what happens in Washington. It is completely free. No sales pitches, no spam, just the information that could save you hundreds or thousands of dollars. The link is in the description. Please click it right now before you move on. And if this video helped you today, please share it with someone you care about. A spouse, a sibling, a neighbor, a friend on a fixed income. They may not know that their COLA raise is being quietly taken back by Medicare before it ever reaches their account. Sharing this video could genuinely protect their retirement. I am Masha. Thank you for trusting TaxWise Seniors. I will see you in the next one.